Hi, my name is Bob Bingu. I'm the Vice President for Medical Education here at Maine Medical Center. I'd like to welcome and thank Dr. Jane Pringle for spending a few minutes with us to talk about retirement. So first, Jane, if you could just give us a little bit about your background.
Sure. Thank you, Bob. I enjoy being here. I have practiced in Maine since 1976. I had my training originally with a Bachelor of Arts in History at Denison University in Central Ohio, small college similar to Colby, Bates, and Bowdoin. I went to medical school at Case Western Reserve University School of Medicine in Cleveland, and right out of medical school I did a straight medical internship at University Hospitals in Cleveland. While I was in medical school, I met my husband, who was a class ahead of me, and he was interested. He was doing a general surgical internship and first-year residency before moving into a urology fellowship. It was the Vietnam era, and most of the fellowships were filled with folks coming back out of the military. So urology programs in the U.S. were full, and we went to a family wedding up in Montreal and realized that McGill didn't have the same problems, and he decided to do his urology fellowship at McGill. So I finished my internal medicine residency at Royal Victoria Hospital, which is a teaching hospital of McGill Medical School. And when we finished our training, we were looking for a place that would be a good balance between an academic medical center and a more community-based practice. So we moved to Maine in 1975, I think.
And you've been here since?
Been here ever since, practiced here my whole career.
Great. Well, thank you.
Yeah.
So as physicians think about retiring, what kind of areas do you think physicians should be thinking about? What kind of broad areas?
Yeah. Well, I think it's similar to the decisions that you make throughout your life about what you enjoy doing and what do you have to do to be able to do that. Obviously, retirement, one hopes that you have put aside enough resources so that you can afford to live and do the things that you like to do. But throughout your career, I think you pick things that hopefully give you satisfaction and make life meaningful. And obviously when we work, we get paid for it. Hopefully we put some of that aside and plan for the future. Some people, I think, love their medical career long enough that they find a way to do it as long as possible. Others maybe get ready for a change. Many of us have things we like to do throughout our career that we then have more time for in retirement. So I think the biggest question about retirement is the same questions you ask throughout your career. Am I happy doing what I'm doing? What is it I'd like to be doing? What do I need financially or educationally to be able to do that?
Okay. And how did you go about yourself planning for retirement?
Well, I think the first thing you think about is what do you need financially to be able to make it without a salary coming in. But I loved what I did, and I felt that it would be nice, and I've seen other colleagues in medicine who were looking forward to doing some of what they were doing, but maybe doing it a little less intensely. Not as much night call or not as much many hours in patient care, but hopefully being able to do that. So I was lucky that I had several different phases of practice, types of practice, both private practice and hospital-based practice. Got involved in the teaching program here, got involved in medical education, residency education, and indigent care. So all those things influenced what I would choose to do in retirement. You know, in terms of avocations, you think about, do you like to hike or play tennis or play golf or travel? I think the thing that I was looking forward to doing more in retirement was having more time to read for leisure rather than for professions.
Okay.
And a little more time to spend at our camp at Moosehead Lake, or now that our children are grown and we have grandchildren, the opportunity to go visit them and support them and be involved in their lives.
Yep. I'm sure it's individual for every physician in
Yes.
terms of the process for
Right.
thinking about retirement. How long would you say time did you spend thinking about planning for retirement?
Oh, that's a hard question. I think you probably start thinking about it somewhere along the path of doing your career.
Okay.
I know my husband thought he would want to retire early because he had so many other interests. And yet he ended up leaving clinical practice because of a disability with a vertigo. And when he had to leave, even though removing himself from some of the stresses of practice, I think he realized that maybe early retirement wasn't what it was cut out to be.
Okay.
Meaning work is good for us. It helps define who we are.
Yep. And as you were planning for retirement, what did you find useful in terms of resources or people you talked with or along the way?
Well, I think obviously you need help financial planning. So I think having a financial advisor who can help you look at your budget, look at what you've put aside in terms of retirement savings, what the rules are about Social Security, and
Okay.
when your Social Security will kick in, and whether you keep working after you start collecting Social Security. I think that was very important to me, feeling confident that you know, you could afford to stop having a regular paycheck.
Okay.
I do think that a lot of what helped me plan were passions that I was interested in.
Okay.
So as I was ready to move out of, you know, a 60-hour work week and cut back a little, I was going to do part-time work in the clinic rather than be the director of the clinic. But politics motivated me because of indigent care and the governor who said he wouldn't expand Medicaid.
Yeah.
And a nurse in the clinic whose husband was in the legislature. Sometimes things come together and create a new path for you. So I ended up deciding that in retirement I would run for the legislature, and I was elected and served. And that was a wonderful new occupation for me.
Yeah. So how did you find those particular resources, like around public advocacy or teaching?
Okay. Well, the public advocacy was easy because being a member of my professional organization, the American College of Physicians, they have a very active advocacy organization, and in fact encourage a program called Leadership Days. Every May, members of state chapters or just affiliates can come for a 3-day or 2-day session where you get educated in advocacy and how to do it, and then you see the positions that the ACP has worked on for public health and for patient care that they want to advocate in Congress, and they help you with the logistics of organizing your visits with your congressmen and congresswomen. And so I had started that while I was still working because I felt so passionately about some of the problems our patients had who didn't have health insurance.
Yeah.
So your career can start you in areas that create a role for you down the road that you might not have had as much time to do during.
I was just about to say that. It sounds like you continued a lot of your passion and your interests into retirement.
I did.
On a different scale.
Absolutely.
Okay.
And I'm still involved with our main chapter ACP in advocacy, and it's a very enjoyable thing to have learned how to communicate with people who can do something about things.
Okay. So currently,
Yes.
how are you still engaged professionally?
Well, I guess mostly with the ACP. I have done some teaching for medical students who are learning physical diagnosis. As you know, there are some Caribbean medical schools who have a campus here in Maine, and there's been a need. They bring students 3 times a year to do an introduction to clinical medicine. And there are quite a few other retirees from the Portland area community who have found that as a very rewarding And it's, again, not full-time. It
Mhm.
is a limited basis, and yet you enjoy mentoring and coaching and
Mhm.
teaching young people who are trying to become physicians. So,
Yeah, great.
yeah.
Well, any final words for physicians who are thinking about retirement? What would you suggest?
Oh, well, I think the most important thing is to think about the passions that you have.
Mhm.
Think about the things you've been putting on the back burner.
Mhm.
You've been wanting to do more. And because I do think it's pretty important to have some idea of the things that you want to do
Mhm.
when all of a sudden your calendar is not driven by somebody else. And obviously important financial planning, making an assessment of what your assets are, what your income flow is, and how much do you need to live on.
Yeah.
I think as physicians, we have incredible flexibility to do a lot of things
Mhm.
that can generate continued income if we want to.
Okay. Well, thank you for your time.
Thank you for inviting me. I enjoyed the conversation.
Okay, thanks.
Thanks.